Hi everyone, my name is Frances Perez. You might recognize me as the nurse working at Olean General's emergency department. I'm the nurse stroke coordinator there. So I just wanted to give you guys some updates that we're having here at Olean. Within the next few short months, we're going to be launching a teleneurologist program and what that means for you guys. So with a teleneurologist, when you guys are bringing in a code stroke alert, the teleneurologists are going to be on a computer screen meeting you at the door. When we started this process and really talking with them, one thing that they asked is that all of the information that you already give us over the EMS radio, they're looking for that as like a snapshot on the patient. So with that, working with Southern Tier and the Cat County EMS Advisory, they came up with this sticker. And again, this is the information that you're already telling us, but it gives it in one spot that'll be on the sticker we have that information as soon as they come in the door. So this is for the nurses and the teleneurologists, so the sticker would stay right on them and not go with the registration group. You would still have to give them the patient's name and date of birth. On the sticker, we have the patient's name, date of birth, last known well, a family member's cell phone number, their glucose, their FAST ED, so B fast would be positive and their FAST ED score. Are they on an anticoagulant? And if so, which one? The purpose of having this information as soon as possible is we find that we have some patients that aren't from around this area or their information has changed. So their spouse may have passed away, and that's who we have listed as their next of kin to call for consent for the thrombolytic. So we would have the most up-to-date information. You would want to start this sticker at the patient's home with especially the patient's family and their cell phone number, getting, if they are on an anticoagulant, and then bring that information. The rest you can fill out on the way in. You'd be calling that information over the radio, but we have it in one little snapshot as soon as they arrive. So another point that we want to make aware that is letting the family members know they're going to be getting a phone call from us. The teleneurologist and even the ER provider likes to have a conversation with these patients regarding the information that you guys are bringing to us, but then also consent is a big thing with the thrombolytics, and having that conversation with the family and with the patient so that the way they all understand the treatment for that patient. One more thing I wanted to touch base with you guys is on the Olean General side, we have what's called a data collection form for our code strokes. The top portion of that is all related to EMS. So when you guys bring your patients in, feel free to look at that form and make sure that you're getting credit where credit is deserved. You know that you said those things over the radio. Make sure we capture that on our end, and then you guys get credit for our stroke accreditation. You guys are doing a great job, and I want to make sure that you guys are getting the credit that you deserve. I know that your EMS crews do educate on this, but the last known well versus symptom discovery. So this can be confusing for the families when we ask. So as we as healthcare providers can be really clear with them that if the patient woke up at 2 a.m. with the symptoms and the spouse or daughter, son saw them at 9 p.m. when they went to bed, just clarifying with the family that 9 p.m. would be the last known well if they were normal at that time, but they woke up at 2 a.m. with the symptoms, that is the symptom discovery. All right, so I wanted to give you guys a little update also on our thrombolytic administration. So as you know, or maybe don't know, our goal to give the thrombolytic is from when they are received in the ER to 45 minutes. So we are hitting that metric. We're at 67% for that. The goal is to hit it 50% of the time. But something that I wanted to celebrate with you guys is we had 13 cases last year that we actually are giving the thrombolytic in less than 30 minutes. And they all came in through ambulance crews from our surrounding area. So thank you for sending out the stroke alert, giving us enough notice to get the things going. You guys started their IV, got the process rolling, and we were able to do our fastest time is 13 minutes, which these are numbers that Buffalo General does. So you guys should be really proud of yourselves. Thank you.